Today we're going to cover the superior mesenteric artery, which is one of the main anterior branches coming from the abdominal aorta to supply part of the gastrointestinal system. So there are a few key facts that we need to cover first. The first is that it arises at the vertebral level of L1. And secondly, in terms of the region of gastrointestinal system that it supplies, we can break it down into the three main embryological divisions of the gastrointestinal system, consisting of the foregut, the midgut, and the hindgut. So the superior mesenteric artery, by and large, supplies the structures within the midgut. And that consists of the duodenum, specifically the area that is distal to the major duodenal papilla, which we'll cover in more detail later on in the video. So as well as the duodenum, it also includes the jejunum, the ilium, the cecum, the ascending colon, and the transverse colon, but specifically the proximal 2/3, because the distal third of the transverse colon is supplied by the branches of the inferior mesenteric artery. Now we will move on to specifically the branches of the superior mesenteric artery and where they course throughout the body. And so we'll start by drawing the abdominal aorta, like so, traversing inferiorly and branching into the common iliac arteries. And we can see the origin of the superior mesenteric artery as the little dot here, and then we can see the artery traversing inferiorly, like so. For the first branch of the superior mesenteric artery, we'll draw this in blue, and this is the inferior pancreatico-duodenal artery. Now, if you have recently watched the episode that I created on the celiac trunk, you will know that one of the branches coming from the gastroduodenal artery is the superior pancreatico-duodenal artery. And so we know from the previous video that that supplies the superior portion of the duodenum and the head of the pancreas. And so the inferior pancreatico-duodenal artery supplies the inferior portion of these structures. And so we can see in the middle diagram the inferior pancreatico-duodenal artery traversing superiorly here. And then on the left, we'll draw a more detailed view of this area. And so we can see the lumen of the duodenum here, and then the nice C-shaped structure, like so. We can see the other end of the lumen, and I'll just draw the rest of it here. So we can see the nice C-shaped structure of the duodenum here, and then we can see the duodenal-jejunal flexure, which is the acute angle just here, indicating the transition between the duodenum and the jejunum. And in yellow, we'll draw a very simple pancreas, like so, and we'll just briefly colour it in. And so you can see the head of the pancreas nestled in to the C-shaped curvature of the duodenum there. And so in red, I'll draw the superior pancreatico-duodenal artery traversing inferiorly, like so. And then in blue, I'll draw the inferior pancreatico-duodenal artery traversing superiorly. And you can see the meat in the middle and they anastomose with one another. And they anastomose at a particular point. And I'll draw this in white here. So the duodenum is split into 4 different parts. And in the second part of the duodenum, you have the major duodenal papilla. I'll draw this. Major duodenal papilla. And this is an opening into the duodenum that allows exocrine secretions from the pancreas, as well as bile that's traversing from the gallbladder and the liver to empty into the digestive system. And this is an important landmark because it denotes the transition point between the inferior and superior pancreatico-duodenal arteries, respectively. So that is the first branch. There we go. And so the second branch is, let's see, we'll denote this in purple. The second branch is more of a collection of branches, okay? And so these are the jejunal branches. And we'll show in pink here the ilial branches. So in the central diagram, we can see the jejunal branches traversing to the left, and then the ilial branches, again traversing to the left, but just inferior to the jejunal branches here. And these are grouped into different they're categorized into different groups of branches as opposed to one single branch, because they anastomose together to form particular anatomical structures. Now, the interesting part about this is that for the duodenum and the pancreas, most of the duodenum is retroperitoneal. And so it doesn't, most of it isn't suspended on a mesentery, whereas the jejunum and the ilium are both intraperitoneal. So they're suspended on a small bowel mesentery, which is a reflection of 2 layers of peritoneum stemming from the posterior abdominal wall. That helps to suspend the small bowel to prevent it from moving around too much, and also provides an avenue for different lymphatics, as well as arteries and veins and nerves to course back and forth from the small bowel itself. And so I will draw a cross section of the, let's see, we'll just say this is the jejunum. So you can see a cross section here. And in grey, we can draw the small bowel mesentery and then colour in the posterior abdominal wall here. And so in terms of blood vessels, we'll have the jejunal branches stemming from the superior mesenteric artery, like so, into the small bowel mesentery, just like that. And this is where it gets interesting, because they then form what are called arterial arcades. Arterial arcades. And these are semicircular anastomoses that you can see like so, that continue distally, like so. And they continue towards the small bowel itself, and once they get close enough, they then branch into straight arteries or straight branches, which are called vasa recta. So this is the arterial structure for both the jejunal and ilial branches coursing through the small bowel mesentery. Next up, in yellow, we have the ilio-colic artery. And so to demonstrate this in a bit more detail, we'll draw the terminal ileum, the cecum, the ascending colon, and the transverse colon, like so. And we'll draw a little appendix in the end as well. So in terms of the ilio-colic artery, we can see the branch coming down inferiorly and to the right, like so. And on the left-sided diagram, we can see the ilio-colic artery traversing here, supplying branches to the terminal ileum, as well as the cecum, and also giving off an appendicular artery that supplies the appendix. Next up, in green, we have the right colic artery, and we can see it branching off and traversing to the right here, and we can see the artery on the left side of the diagram providing branches to the ascending colon. And finally, in, let's see, we'll choose a kind of mustard colour. So finally we have the middle colic artery. We can see it travelling to the right and superiorly here, and we can see it giving off branches to the proximal 2/3 of the transverse colon. And interestingly, with these three main branches, the ilio-colic, the right colic, and the middle colic, we also have marginal arteries, which I'll denote in red, that link between them, like so, and they give off marginal branches to the kind of transition zones between the main supply of these arteries to make sure that there's no area that is not as supplied or is less supplied with blood compared to the kind of central regions where these arteries supply. So that is the branches of the superior mesenteric artery. I hope you enjoyed the video and you found it worthwhile. If you have any questions, feel free to pop them in the comments down below and I'll get back to you as soon as I can. Until then, I'll see you in the next video. Thanks very much for watching.